Alrighty, if I can push play. Injury prevention for wrestling. So I'm Tatiana Sanchez, and my topic, of course, is going to be wrestling. So I kind of added the nice little prompt on what all the questions we had to answer, as well as like what to include on our slides. So number one was our inquiry. I decided to pick playing sports as the topic, and I specifically directed it to wrestling. So wrestling is a contact sport. It involves collision and extreme demands of one's body, whether it be physically or mentally. There are skills, techniques, and trainings that go into this sport just to prevent injuries. But it doesn't mean that injuries won't happen, right? So they wear certain things. We do have them wear headgear, which protects their ears and their head, of course, from like colliding and bumping hard. Wrestling shoes, the wrestling shoes are going to be these ones right here. They have this nice little ankle support so that no ankles are truly twisted, as well as a singlet so that no like clothing gets torn off or pulled. And if they have braces to prevent anything from like your braces getting stuck to your lips or cutting another opponent, we make them wear mouth guards. Where do they wrestle? Well, they wrestle on these nicely hard cushioned mats. It doesn't make sense, right? Because if it's a cushion, how is it hard? Well, it's supportive. It's soft enough to land on, but it's not soft enough to want to continuously lay there. Alrighty, so as I said before, wrestling is a contact sport. Everyone's going to collide with somebody, and they'll have to push themselves as well. Bruising is one of the injuries. It's a skin injury. It's bleeding from under the skin, and it usually turns your skin either black, blue, green, or purple, just depending on the amount of bleeding there is, as well as the healing process. The next one are scrapes, of course. You're going to always get mat burn, depending on where your body is and how it's positioned, which is usually a skin wound that results in the skin tearing or rubbing off. Next one is going to be a concussion. Usually it's a traumatic brain injury, so it affects the way the brain functions for a period of time, depending on your healing process. The next one is like a cauliflower ear. It's technically collection of blood in the ear, and it like swells up. If it's not properly drained, it can end up leading into an infection, which would end up either going to the hospital or getting it cut off permanently. And then, of course, there's strains and sprains, which is technically a muscle being overstretched or torn, as well as long-term injuries. Now, these injuries will require surgery, and I'm not saying that none of the injuries need time to heal, but this one will need the longest, meaning you can tear an ACL or tear a shoulder muscle. That's something that results in surgery needing to help repair the muscle. So how do these happen? Again, we have a sprain in the ankle, bruising, and of course cauliflower ear. So certain things, of course, like bruising, it can be just as simple as a hard hit or even like grabbing the skin too hard. Sprains, of course, being overstretched again. So these are just things that happen, not purposely, of course, but end up happening just by the force and aggression that's happening within the match. So again, tearing, wounds, bleeding, and of course you're always going to get knocked in the face. So there's always going to be bleeding or a concussion at the end of the match at some point in your career. So statistics show that college injuries, usually you have a knee sprain or strain, which is like 17% of the time. Shoulder strains or dislocations, you'll have an 8%. Head and lacerations, like bleeding, again from the nose or getting mat burn across the face is 7.4%. Hurting your ankle is usually because your shoes aren't tight enough to support your ankle, which is 7%. Concussions, again, we do have the headgear so that your head doesn't collide just head-on-head contact with the opponent, but sometimes it does happen depending on the position of the heads as well as the location, which is usually about 5.8%. You have your trunk sprains, which are 5%, and you have like upper leg, hip strains, and sprains, which is also 5%. Now, when you go to high school injuries, you're looking at shoulder sprains and strains, which is 8.5%, ankle strains, 7.6%, knee strains, 7%, trunk sprains, 6%, neck sprains, 5.4%, and concussions, which are also 5.4%. Now, the reason why high school injuries are, of course, lower than the college injuries is because college injuries are usually because college has more experience, but they are also have more moves that are more complex than high schoolers do. High schoolers will, of course, learn certain moves that are more like complex than others, but we try to keep them to like the basics so that no injuries are permanently happening to them, as well as the refs are very serious on about the angle of the body positions as well as where the other opponent's body is at. Now, let's talk about the causes and the preventions. Depending on the location of your injury, there are different ways to prevent the injury from happening. So your upper body. What causes the upper body to end up getting hurt? It's usually because you're trying to stop a throw or go against gravity. So what do you do to prevent that? You tuck your body and you fall with it, meaning keep your arms tight into you and tuck your head, usually. Your lower body, like your legs getting strained or something, it's because they were overbent, meaning they went past a certain angle on what your body is able to do. And you usually prevent that by being flexible, because sometimes the more you stretch, of course, the more flexibility you are gaining and more your body is able to transition into certain angles, or just simply knowing how to counter a move. So if one move is, if I was to get sat on if someone was to sit on my legs, my option was to get out of there before they end up pulling it up too high to where it hurts me. For your head, like concussions, you usually will never go head straight to the mat unless you try to prevent it from happening or you stiffen up. And usually to prevent that, you just tuck your head and again, you go with the flow. You don't go against gravity and you just fall. Your sprains, of course, happen because they were overpulled. You prevent that by stretching. I personally, with high school wrestlers, they don't take stretching very seriously. So when they get hurt or they're sore, it's because they didn't take stretching seriously and being able to stretch the muscles that were tight already. So the Hayden Matrix. My host was my athlete, of course, and the pre-event was understanding the techniques and skills going into the sport. And then for the physical environment pre-event, your wrestling mats have extreme cushion, so when you're being thrown or you're falling or even getting your body weight put on you, like someone sitting on you or something. And then you have the social environment. Understanding that everyone has different levels of force and aggression when you come into the sport. Not everyone's going to be soft and dandy, or they're not going to be extremely strong just because of how they look. So everyone always goes in with a different level of strength. Now you have your events. For the athlete, applying the skills that are taught as well as feeling where your opponent body is, as well as countering the moves. Countering moves means just like finding different ways to stop a move from happening before it happens. And then your agent, when they're brought down to the mat, go with the gravity, the gravitational energy. Go ahead and fall to that mat. Don't try to stop yourself in any of your physical environment, which again is all of the gear that I talked about earlier. So you have the headgear, the Velcro shoes that have the really tight shoelaces, and then you like the singlets. Your social is adjusting to one's force when facing the opponent. You won't ever know how much aggression or the level of force someone has until you step up on that mat, shake their hands, and the match begins. So you kind of have to adjust yourself. And if they end up being more aggressive than you, then apply that same amount of aggression. Your post event. So you have to adjust your moves and study your opponents. So at the end of the match, if you won or lost, you're always going to face that same person again at some point within your season. So try to learn what they do and try to learn how to fix your style to beat them. And you're going to have thermal energy, of course. After the match, you're all sweaty. It's because you've been working and then you had an extra body with extra weight just being put on top of you. And then you have the physical environment. So the space, usually when a wrestler is hurt, space is given. Coaches and the athletic trainers are the only ones allowed to be on the mat. The other wrestler and the coaches have to step away just so they give the wrestler time to heal, whether they want to continue the match or let them win by default. And then your social environment. Usually most wrestlers will continue the match even after being injured, and it's usually because at the end of the match, you are welcome to shake the other opponent's hand and get the assistance needed after. I did wrestling personally because for me, I didn't really know what I was doing, only because I was a senior in high school and I was so scared every single time I stepped up on that mat. But I had recently become a coach for them, and one injury that I ended up getting was a strained shoulder blade. It wasn't on purpose, of course. We were in practice and my arm went cross body, so it was at a normal angle, but what had happened was she pulled it too far and all her body weight went down to my shoulder, which ended up tearing a ligament. So I was not able to practice with them or help them coach for at least 2 weeks without feeling extreme pain when I even lift my arm. So being able to talk about this and help prevent more injuries from happening was kind of like, oh, I want to do this. So that was the reason why I picked this one personally. And then these are my sources. I used just kind of like treatments on how to prevent certain things, as well as statistics on injuries and how to prevent those injuries. And that is the end. Thank you.